Okay, in this video, we're going to talk about the macroscopic anatomy of bones. We're going to use long bones as our way to look at the different parts of a bone that you can see with an unaided eye. That's what macroscopic means. So the first parts of the long bone we want to identify are the ends of the bone, the epiphysis. And there's a proximal and a distal epiphysis. And that has to do with, again, proximal and distal were those terms we talked about when we talk about points of attachment. So in the video here, where the head of the femur is, where it would form a joint with the hip, that's the proximal end, and the distal end is where it forms a joint that's part of the knee. In the ends of the bone is where the bones grow, and that's called the epiphyseal plate. And so in a person who's growing, the epiphyseal plate is still hyaline cartilage, and then once a person stops growing, the remnants of that growth plate or epiphyseal plate become the epiphyseal line. The shaft, or the bulk of the bone, if you will, is called the diaphysis. The ends of the bone where they form a joint are covered in articular cartilage, which is hyaline cartilage, and it's there to protect the bones in the joint so the bones don't rub against each other. And then in living bone, there's the periosteum, which is a membrane that covers the diaphysis, and it has blood vessels and things that supply the bone. Remember, bone is living tissue. There are two types of bone tissue in a long bone. There's compact or solid bone that make up most of the diaphysis, and then spongy bone, which has lots of open spaces like a sponge, is primarily in the epiphysis, and it's composed of trabeculi, or little pieces of bone. It's inside the spaces of spongy bone where you find red bone marrow, the stuff that makes your blood cells. The medullary cavity is the space in the diaphysis that would be filled with yellow bone marrow, and it's lined by a membrane called the endosteum. So you have a membrane on the outside of the diaphysis, the periosteum, and a membrane on the inside called the endosteum. The medullary cavity in living bone tissue is filled with yellow bone marrow, which stores fat. Here you can see in a freshly cut cross-section of the bone, you can see the compact bone in the diaphysis filled with the yellow marrow. It's not really yellow, but because it has fat in there, we call it yellow marrow. Here we have the compact and spongy bone in the epiphysis, and you can see this is a person who stopped growing as they have the remnant of the epiphyseal plate, the epiphyseal line.